أولادكم بعدهم أولادكم، حتى إذا شغلة فيهم تغير بعدهم مثل ما بتعرفون.
Dr. Zavi Lakissian, you're an instructor in the Department of Family Medicine and a co-director of the Simulation-Based Education and Research Program at AUBMC. You are the Healthcare Access and Gender Affirming Care Project Manager at Helem and an Executive Board Member in LebMASH. You are also a fervent advocate of the LGBTQIA+ justice, equity, diversity and inclusion, particularly health equity, and have led many training and awareness sessions for healthcare students and professionals, public and private healthcare institutions, NGOs and private businesses. It brings me pleasure that you are here with us in this episode. رح نحكي عن LebMASH, what LebMASH has done so far for Lebanon, ورح نتطرق كمان شوي عن ال GCE practices اللي عم يصيروا illegally بلبنان unfortunately. إذا بدنا نبلش briefly, what is LebMASH?
Thank you for having me, Nazia. It's a pleasure to be here. So LebMASH is around 10 years old already. LebMASH, Lebanese Medical Association for Sexual Health, brings together healthcare professionals and providers. Our main mandate is to provide equity through healthcare and to promote equitable access to healthcare for sexual minorities, particularly the LGBTQIA community in Lebanon. And we do this by raising awareness, by training healthcare professionals and providers. We do this through generating knowledge and also by advising and helping change policy that affects this vulnerable population.
Mm-hmm. What are some projects LebMASH has done in the past or have done now?
Throughout the years, LebMASH has been quite active in generating some knowledge about the community status in Lebanon, particularly though working on LebCare, LebGuide, LebSource. LebCare focuses on GCE practices in Lebanon, highlighting and monitoring what is happening and also offering a recourse or a avenue for reporting GCE practices by people who've undergone that horrid practice.
بس لحتى the audience يعرفوا GCE is sexual orientation, gender identity change efforts, or what is known not scientifically conversion therapies activities اللي بنعملها.
Yes, and we will talk about it in detail in a little bit. And we also have a hotline that is provided on our social media platforms as well as on the website for people who've undergone this treatment, quote unquote, to report these practices. So then later on we can either report on the people who are practicing it or the institutions that it is being practiced through. On LebGuide, we have a list of gender affirming and LGBTQI affirming practitioners and healthcare providers and that have undergone rigorous process of selection. We're in the process of updating this list, particularly after the exodus of healthcare professionals we've seen in the past few years.
Especially with COVID. Yeah.
Yes, exactly. And especially for affirming physicians, particularly those working in endocrinology, internal medicine, family medicine, or primary care practitioners. And also we have LebSource, that is basically a collection or a directory or a repertoire, if you want to call it, of resources for LGBTQI individuals regarding healthcare in Lebanon, or even practitioners that are looking for guidance or guidelines on affirming care. All of this is available on LebMASH's website and accessible to anybody.
كل هول رح ينحطوا بالكابشن ده hotline number و the website و also كمان the social media handles. طب recently هلا what is LebMASH working on?
Like I mentioned, we are updating LebGuide to include new physicians who are up and coming in the field and can provide affirming care and safe environments for community members. We're also right now starting a mapping project that highlights establishments in Lebanon, whether they're healthcare providers, hairdressers, nail salons, restaurants and bars, clubs that are also LGBTQI LGBTQI friendly. It will also include establishments that have undergone our training for sexual orientation, sexual characteristics, and gender identity and expression, and will provide either a directory or a sticker that will be placed on the establishments that points out or indicates that they are LGBTQI friendly and they provide a safe environment for for community members.
Here it's just basically for the members to feel safe in that place. It's not like it's attracting only queer individuals.
Of course not. Yeah. No, but we want to ensure that members from the community who visit these establishments feel safe either through their interactions with staff, or they know that if they do encounter any sort of aggression or discomfort from other patrons of the establishment, that their rights will be protected to be there. So that is very important for them to know where they can go and be themselves.
Yeah.
In addition to this, we're also working on dating with pride. You know that within the community there has been several instances of catfishing, where people have been targeted because of their identities and orientation. So we want to make sure that we're providing them the resources to safeguard their dating, so that they feel safe during dating. And who they're dating, including, for example, making sure that people know where they're going, making sure that they do a background check on the people they're going out with, to share the location of the place that they might be going. So tips and tricks of how to avoid any negative events or incidences through dating in Lebanon.
Making it a bit more inclusive for Lebanon, exactly, for the community, and from the community to the community.
Because we will be building this directory based on survey filled by members of the community. Any instances of negativity that they've encountered through dating, what are the specific things that we need to target?
Any major difference LebMASH was able to do with Lebanon?
I think the biggest difference that we've been able to do is through our trainings. Because by training healthcare providers to be more aware of the healthcare needs of the community members, particularly trans individuals, because transitioning requires a lot of healthcare access. It requires a lot of healthcare accommodation, I want to say, although that's not really the right word for it, but if they want to go through hormonal therapy, or if they want surgical interventions, even if they want to begin those, they might need a gender dysphoria diagnosis, let's say. So all of this has different levels of healthcare service that they need to be engaged in, and we want to make sure that the providers are ready to receive these clients through their either private practice or the institutions they're working through. The trainings have been crucial as well when we've been training businesses and NGOs so that they're more inclusive in their hiring practices. At the end of the day, a gender identity or a sexual orientation does not affect the way that a person can do their job.
So حتى their skills أو حتى their background.
100%. They should not stand in their way of finding profitable employment, finding healthy, finding appropriate employment, let's say, so that they can lead better lives, so that they can improve the quality of their lives. I think this has been the biggest avenue, as well as our LGBTQI Health Week that we do every year. It's been great having that access to young healthcare professionals or students who will be healthcare professionals to teach them the skills needed, either in communication or practical skills, on how to be better ready to see LGBTQIA patients.
Well, I believe كمان in 2013 إذا ماني غلطان LebMASH played a huge role لما طلعت الستيتمنت من السايكولوجي Medical Association Psychiatry Medical Association doctors إنه homosexuality is not a disease and it's not supposed to be treated as one.
We also have Break the Silence competition that gives the opportunity to young researchers and scholars to present their work, have advisors who work from the field, whether from the board or otherwise, and to present their work in international conferences and get published.
Very impressive.
Yes,
very nice.
It's been very nice.
You mentioned one of the community health related needs. What are other needs in your opinion might you think of?
So I want to focus beyond the sexual and reproductive health, because we've been focusing a lot, not just as LebMASH, but most of the organizations that do provide services for the community on sexual and reproductive health, STIs, etc.
Yeah, testing.
But the thing is that just like anybody else, LGBTQI members have regular healthcare needs. They have headaches, they have stomach aches, they have fractures, they need emergency rooms sometimes. So I wanna highlight the need for the community in general healthcare access, not necessarily sexual and reproductive health. In addition to this, currently, we don't have guidelines that mandate or give a direction for providers on how to approach transitioning. For example, internationally, we've got the WPATH guidelines, and those suggest that you need a gender dysphoria diagnosis before going through hormonal therapy, before going through surgical treatment. The main issue with that even is that not everybody who is trans is gender dysphoric. Yeah. So even there's a bit of discrimination by the system on community members. But in Lebanon, some physicians choose to follow WPATH, others don't. There is no consensus. So everybody basically follows their own guidelines on what to do and what not to do. So depending on the physician that they are going to talk to, they may face a lot of issues if the physician insists on a diagnosis before starting therapy, and others have a much easier way, let's say, to start therapy without the gender dysphoria diagnosis. So it would be great to really come to a consensus or to a set guideline that provides a standardized way of approaching
لأنه هلا a lot of individuals are facing this issue. إنه مثلا let's say they want to consult several doctors, وكل doctor he has his own or their own approach. فهون بيصيروا they don't know who to trust.
Right, exactly. Plus, this is leading to a lot of them just avoiding the healthcare system altogether. 100%. So they self-prescribe or self-dose the hormones, which is a problem because not everybody can take the same dose, and regardless, coming to a dose that is perfect for the individual takes a lot of trial and error, takes a lot of time, and it needs to be monitored by a professional to make sure that we don't have any adverse effects of hormonal therapy, to make sure that there aren't any comorbid conditions like hypertension or diabetes that might change the way that we administer the hormones. So it's very important to have a healthcare system ready to provide the care needed.
عم نحكي نحن international guidelines، ما عم نحكي إنه مش عم نجيبهم من الفضاء لحتى ما العالم يفكروا إنه والله we are creating something. Exactly. It's already there, the need is there, and the guidelines are there. Right.
We might need to adapt it a little bit, be more culturally sensitive to Lebanon.
Definitely.
But the standards are clear. They exist for a reason. I think we just need to apply them properly, and everybody needs to apply them similarly.
Yes. What are some examples of policy efforts or research being done to help improve the communities?
So, not particularly through LebMASH, but generally speaking, there are efforts to pass the non-discriminatory laws. And this is very important because right now there are no non-discriminatory laws in Lebanon, whether it's in hiring practices or the treatment that somebody receives at an establishment. There's no accountability system. So having those laws in place would save a lot of energy.
عم نحكي نحن on a national level. Of course, لأنه private sector فيها كم محل مثل Title 9.
Right. So that's great that you mentioned Title 9 because certain institutions have taken it upon themselves to put these policies in place. And it's very important that they do. But again, I think one of the major things that we need to consider is that a lot of members from the community don't know their own rights. So even if they do face some form of discrimination, they don't know where they can place a complaint or who they can report to so that this does not keep repeating. So all they do is they avoid that provider or they avoid the organization, but that doesn't fix the problem.
But sometimes غير إنه الواحد doesn't know their right, they're afraid. The fear of إنه يصيروا confiscated for something else ما عملوها بس إنه خلاص لأنه they are part of the LGBT LGBT community بلبنان يلا
صح.
نطلع لهم شيء.
صح. But again, that goes back to knowing that even if you are part of the community, you have basic rights that cannot be violated, regardless. Like some things are being done illegally or unorthodox ways that breach the person's rights. So that shouldn't stop them. You know, they should know, and we need to be more transparent in what those rights are and how they can defend it, and if they are breached, how they can reclaim them.
100%. طيب إذا بدنا نحكي شوي technicalities على السو جي سي إي اللي عم بيصير بلبنان the practice the change efforts اللي عم بتصير. بدنا نخبر بس العالم what is سو جي سي إي.
So, sexual orientation, gender identity change efforts.
Yes.
So, to begin with, it's a practice that is internationally out of date. It is internationally considered unacceptable. Even its own pioneers by the 80s knew that it was useless, knew that it had no outcome except harming the person more. They even recanted or disowned the practice, the people who began it. And it is tantamount to torture, if I can put it in the simplest terms. Basically, what it does is it forces an individual to quote-unquote change their orientation or identity if it does not fit the heteronormative standards الموجودين بالمجتمع. It includes, for example, electrocution. It includes, in some cases, depending on who's doing it and where it's being done, electroshock therapy. It includes exposure to heteronormative pornography. It includes chemical castration in some instances, or provision of emetics that make it right. That in simple terms, that means that they're given some pill or medication that forces them to throw up when they are shown images that fit their orientation and identity.
لما بيشوفوا there's an activity of an erection or an activity in their body that is exciting them, بيحطوا this vomiting. This emetic.
They show them, for example, a gay couple or a lesbian couple, and they at the same time give them something that makes them vomit, so that there's an association between vomiting and being sick with seeing those images. All this practice does is force people to find out better ways of hiding their identities, right? A lot of times people come to you and say, but some people want to change. That's not true. All they want is to stop feeling judged. All they want is to stop feeling like they're doing something wrong, or to stop feeling that they're not accepted or marginalized. So even if they come to somebody asking for change, they're coming there not because they don't like who they are, it's because they can't live who they are. And I think that's one of the biggest things that people in positions of practicing sexual orientation, gender identity change efforts manipulate and take advantage of.
It's your mind games.
Exactly. And they hide behind it, you know, like, oh, they want it, we're doing something that they want, we're providing a service that they want. شغلة تانية انه لازم ننتبه له انه كتير اهل بياخدوا اولادهم اللي هن اصغر من عمر 18 بعد ما وصلوا على عمر البلوغ اذا بدنا نحسبها or adulthood, وبياخدوهم وبينجبروا الاولاد يمرقوا بهالتجارب السيئة لأنه ما بيحق لهم بعد يقولوا لا.
صح.
وهون لازم الهيلث كير بروفايدر يلعب دور الادفوكيت، مش الادفوكيت للاهل بس الادفوكيت للولد للماينر،
يوعي الاهل انه عم يعملوا شيء غلط
100%، انه هو يكون عم بيساعد الولد يفهم الاهل انه ما في شيء غلط هون،
صح،
ما في شيء مرض لازم له العلاج. إذا شيء لازم يتأمل لهم coping mechanisms, supportive mechanisms ليتقبلوا يتفهموا الوضع، مش يعني مش يمرقوا يعني أولادهم بهالتجارب الصعبة.
أنا برأيي كمان الجلسات العلاجية اللي بده يخضع فيها الولد لما بيكون بده مساعدة ليتقبل نفسه، أنا برأيي كمان الأهل كمان لازم يكونوا معه بهيدي المرحلة، لحتى هني كمان قد ما هي صعبة على الإنسان يتقبل نفسه، كمان حتكون صعبة على الأهل اللي هني كبرانين بهذا المجتمع يتقبلوا هيدي الفكرة ويتقبلوا إنه أنا ابني هيك، إنه أنا من دمي ولحمي هيك، إنه نحن بنشوفها على التيفي وإنه عادية الخبرية، بس إنه نحن ما يقربوا صوبنا، بس إنه قربوا صوبكم وصارت.
هون كمان انه نحن بنتوقع انه الاهل خلص دغري لما يسمعوا انه اولادهم يمكن gay or lesbian or bi or trans انه دغري بدهم يتفهموا ولازم يتفهموا، بس الصعب عليهم كمان لانه they raise that child they raise them a certain way, right? So it's also for them انه فيها الصعوبة انه يتقبلوا انه اولادهم مثل ما كانوا بطلوا، مثل ما هن كانوا متوقعين او عم بيتخيلوا كيف بدهم يكبروا لازم يتغير. كمان توقعاتهم لازم يتغير شوي، بس هيدا ما بيصير بين يوم وضحاها، هيدا بده وقت. وكمان الاهل بدهم سبورت، بدهم تقبل، بدهم مساعده تا يقدروا هن كمان يوصلوا لهالكونكلوجن بوقت محدد، تا هن كمان يكونوا مرتاحين واولادهم يكونوا مرتاحين وكل شيء يرجع على محله. يعني
I believe Helem is doing something like this.
Yes, Helem does family support therapies, family support groups, and with a great counselor, they provide help and coping mechanisms for the parents and family members of LGBTQI individuals. ليوصلوا على محل انه they're comfortable and مش بس comfortable بس advocating for their children and loved ones.
طب إذا بدنا نعطي رسالة هيك سريعة للأهل يلي recently اكتشفوا إنه ابنهم أو بنتهم من مجتمع الميم أو بيعرفوا بس إنه كابتينة أو in denial أو مش قابلين الخبرية، what would we tell them؟
أولادكم بعضهم أولادكم، حتى إذا شغلة فيهم تغير بعدهم مثل ما بتعرفون. يعني it's going to take time. Give yourselves time. Forgive yourselves. كمان لأنه it's going to take time. Nothing you did led to this.
في بعض الأهل بيفكروا بيلوموا حالهم.
صح، إنه ماشي عملتوه قد لهالشي، ومش لازم نتطلع على موضوع as cause effect. You know, هيدا this is who they are. It's not something that happened all of a sudden, and it's not something that you did. It wasn't your nurturing. It wasn't something that they were exposed to بالمجتمع اللي عايشين فيها. It is who they are. Sometimes we can think of them as a child who's an introvert or an extrovert or someone who makes jokes. Yes, talkative or not. هيدا كمان a part of who they are. It's a characteristic of their identity. It's not their whole person. Right? So give them time to يقدروا to disclose to you, to be able to talk to you comfortably without being afraid that you will no longer love them. Every parent loves their child. They want the best for them. So they may even think that living as gay or bi or trans will make their lives more difficult. Some
parents بيفكروا من هذا الapproach, which is understandable.
100% خاصة بمجتمعنا يعني it won't be easy to lead their life, but because they'll have their support, because they'll have supportive parents, trust me, it'll be much easier.
Easy, of course.
Yes. So they want to play the role of that supportive parent rather than being part of the community that is making it even more difficult.
صح، يعني يكون حتى بيته مطرح آمن.
100% a safe environment for them. Yes, 100%.
بلبنان مين عم يعمل هيدا؟ يعني أنا مثلا حسب معلوماتي مثلا المستشفيات الكبيرة بيبان هدول الخبريات، الدكاترة المهمة اللي تعبانين على حالهم ومخرجين من جامعات مهمة، إنه ما سمعت إنه بيعملوا هدول الخبريات. مين بيعملوا هالخبريات؟
So there are a lot of therapists, counselors, psychiatrists even regular practitioners or doctors, if you would, that have been given the avenue to do this, to practice this, and most of the time it's being mediated by religious figures. And I'm not specifying one religion or the other because it's prevalent in all of them. And the thing is that there's no accountability mechanism, right? So even if they are practicing it, if it's being reported or not, there's no specific punishment for it. So even if let's say Na'abet or Na'abet al-Dakatra or the new Na'abet al-psychologist has rules, ethical codes of conduct about what is right, what is wrong, what is harmful, what is beneficial for your patient. And the thing is that most of these practitioners do this thinking they're doing good.
Doing them a favor.
Yes, doing good. Exactly. So they do not accept the practice as harmful. So they continue doing it despite seeing how it's affecting the patient.
مع انه الاكريديتيشن تبعهم بتقول لهم ممنوع.
Not specifically.
ما بتقول.
No, not specifically, because it says do no harm. It does not say do not do conversion therapy. You know?
But conversion therapy is harm.
Yes, but that goes back to the moral, ethical codes of the physician or the psychologist or the psychiatrist themselves. In the outside countries or internationally speaking, it's not just mandated by the syndicates, but it's also illegal by law. Now
نرجع لحكينا بالأول على خبرية the laws.
100% لأنه هون the issue of being gay or bi or trans is being persecuted by the law. So anybody who's doing anything to these individuals is not going to be persecuted by law. Right. If anything, they've been giving the platform or the ease of access to be able to do this. So it does not help that we do not have laws that punish this practice.
They were advocating for it, advertising for it lately, وعادي وproudful وما حدا قال لهم شيء وما حدا نكشهم.
They have the platform more so than the LGBTQI community to sort of brandish their ideas, their practices without any fear of repercussions, which does not help our cause.
طيب نحن عم نحكي انه هيدول البراكتسز ار هارمفul بيأذوا الصحة النفسية والجسدية امرار. شو بصير؟
اللي بدنا نركز عليها انه الاشخاص اللي قبل ما يبلشوا يمرقوا بالسوجيسي is that بيوصلوا هالمرحلة بعد ما مرقوا بديبريشن، مرقوا بانكزايتي، مرقوا بالستيغما، the lack of acceptance من المجتمع اللي حواليهم.
بيشوفوا حواليهم لا أنا شيء غلط شكله.
100% وكمان بيكون في حالات اللي جربوا فيها الانتحار أو suicide أو they've been self-medicating through the use of drugs or alcohol and there's all of these things that sort of build up لنوصل على محل انه هيدا الشيء اللي بده ينعمل او لازم ينعمل تنرجعهم من محلهم. But SOGC is not the answer. If anything, there are proper psychologists و psychiatrists بيقدروا يساعدوا بهالمواقف مش انه نوصل على السوجيسي.
يعني احنا بدنا نحل الديبريشن ونحل الانكزايتي ما خص الايدنتيتي لانه الايدنتيتي ما فيها حل.
صح. مش لازم نلوم الايدنتيتي انه الايدنتيتي وصلهم لهونيك. اللي وصلهم على الديبريشن والانكزايتي والمشاكل الثانيه انه عدم تقبل المجتمع للايدنتيتي والاورينتيشن تبعهم. فكمان ما بعد الثيرابي اذا شيء or conversion efforts اللي بيصيروا it gets worse. بيسوء الامور ما exactly it doesn't get better. So بنشوف حالات depression more complex و deeper than اللي كانوا من قبل. We see suicidal rates go up. We see again drug abuse, alcohol abuse كمان وكمان we'll notice that their self-esteem is lower, self-confidence is lower. We will notice that they're internalizing a lot of the issues. يعني يمكن عم بيفكروا انه حكينا ووصلنا لهون خلص ما في لزوم نحكي بقى. you know. So they will be internalizing all of these problems rather than talking about it.
Sometimes تقلب internalized homophobia.
كمان
يعني what quality of life are we providing those people? ما في quality of life, ما في شيء.
بالعكس إذا شيء we're reducing their quality.
عم نكبتهم. يعني أنت تخيلي عم تكبتي حدا كل الوقت و it's a huge part of their life. مش إنه والله نقطة بحر حياتهم. It's a huge life.
صح.
How you present yourself, how you act, how you think,
how you're
attracted
behave.
to, the circle you want to be around. كل هدول they play a huge role. نحن طبعا social beings. We need people. We need acceptance. We need tolerance. أو إذا بدك love from others. طب إذا هلا شخص راح عمل هيدا الثيرابي وصار اللي صار. What can they do? What are some resources موجودة available بيقدروا يروحوا عليها؟
So depending on where it happened, when صار conversion therapy, they can even place a complaint للorganization اللي صار في بضمن conversion therapy. They can complain to the NABET directly. They can contact us and report the practice and the person who was practicing this. And of course the hotlines are available. If they don't feel comfortable directly going to the syndicate or the NABET, then they can come to us and report it, and we will do it for them. And of course we can direct them to affirming therapists who can help them deal with the consequences of conversion
It's
therapy.
like مثل كأنه reversing شو صار.
Yes.
Yeah, the harm that they
was
caused.
done.
Yeah.
Yes.
Yeah. طب بلبنان is it something very common? يعني is it outspoken بالخبرية؟ يعني مثلا شخص went through conversion therapy أو change effort. Do they speak about it? Do they try to help themselves ولا بيخافوا؟
هلا نسي one case is too many. Because it should not be happening to begin with. Do they talk about it? They might talk about it if they feel safe in the environment that they're in. Others are even ashamed of having gone through it, so they won't talk about it. So there is generally an underreporting of the phenomenon. In addition to that, talking about it also exposes them to the identity that they were hiding to begin with, you know. So why did you go through such a CE, you know? So you're gay or you're bi or
they're outing themselves بالغلط.
Or they might be outing or discussing it in a surrounding that is not open to hearing that subject. So that in and of itself would be like a vicious cycle, triggering other things to happen that would affect them negatively. So unfortunately there's not enough talk about it. There's not enough reporting happening. I think we need to make it more transparent, more obvious that there are these reporting platforms that are safe for you, that can even be done anonymously if they choose to, and their identities will not be exposed if they wish to keep it hidden. So yes.
وهذا هو أصلاً سبب هذا البودكاست, for us to raise awareness وshed light على هدول المواضيع اللي ما حدا بيحكي فيها. وإذا انحكى فيها بتكون كتير قليلة. طب حكينا عن اللو وحكينا عن the things we're planning to do in the future. بس what more work do we need؟ إذا بدنا نحكي مثلا educational aspect.
There's a lot more work to do, especially now. You're very aware of the past 6 months and all the back steps that we've taken, you know. كنا بموقف إنه كنا عم نشوف شوي تقبل أكتر، كنا عم نشوف visibility أكتر بالمجتمعات خاصة ببيروت. بس بعد ما صار بجون and the events that followed, we're noticing that we're seeing a lot more animosity, we're seeing a lot more aggression, a lot more discrimination. يعني الخطوات اللي كنا اخدينها لنوصل على شي محل هلا عم نشوف انه عم نرجع لورا. There's a lot more to be done to face these. In addition to that, like these individuals, these organizations that are speaking much more loudly and much more openly about their hatred, their prejudices, their aggression, are giving a platform to discuss this. And on the other side, the community and organizations working for the community are being oppressed. They're being forced to keep their mouths shut at the risk of their own members, at the risk of harm reaching their members, or even at the risk of being shut down or losing funding. So I think now we even need to be louder. We need to
هون بيجي دور ال
stress.
NGOs مثل LebMASH وغير LebMASH.
100%. We need to sort of regain or step back into the space that we had taken. Because if you think about the ثورة اللي صارت قبل كم سنة, or if you see any type of change that has been demanded in this country, the LGBTQ have been at the forefront. And not just asking for change for themselves, but asking for change for everybody. At the end of the day, everyone is in the same boat in Lebanon. All the things that people are going through, whether the economic crisis or the lack of resources, lack of healthcare, lack of medication, we're all in it together. And the LGBTQI community has been there speaking for everyone from the beginning. And now for these I want to say ignorant and aggressive groups and comments that have come up speaking against it, they're harming themselves without even knowing it. So now we need to come together. There needs to be more collaborative effort within the organizations working for the community to provide safer havens, safe environments for discourse and dialogue, to come up with better solutions that help all of us.
100%. وإذا شيء on a positive note, correct me if I'm wrong, 4 years ago, هدول statements جداد, بس policy makers أو leaders in البرلمان بلبنان كتروا يلي هني they advocate for the LGBTQ community. فإنه this is a good thing.
Absolutely, yes.
But not change, بس إنه the voice is heard.
It's a step forward. We cannot negate it that it is a step forward.
Definitely. بس من بعد هالstatement كأنه.
Yes. Plus, it's even contradictory, like we won the lawsuit. That means that they cannot stop the community from gathering and congregating and meeting and in their safe spaces. Yet they still continue to do it illegally. But who's gonna stop them? So after the June events where congregating and meeting and holding rallies was stopped by the internal forces and the Minister of Interior, we won the lawsuit against this. It's a recent achievement.
الستيتمنت اللي طلعت بجون هي انه بتمنع الجاذرينجز او التجمعات او الورك شوبس اللي لها علاقه بالال جي بي تي كيو كوميونتي بلبنان. تقدم لوسوت against this decision ومش من شهر اقل من شهر كمان ربحنا لوسوت against the government itself انه لا ما لكم حق تعملوا هيك وانه إلنا حق 100% إن نحن نعمل the gatherings أو the workshops أو whatever we want إلها علاقة بال LGBT as long as it does not negate the manners أو the social conduct of manners اللي موجود بلبنان.
Unfortunately, even despite winning the lawsuit, there have been several events that have been cancelled because of them, because of warnings that the organizations have gotten, because of threats that they've gotten. So now the government itself is acting illegally to try and shut down or try and sort of disregard and ignore the court's ruling.
It's not over. The fight is not over.
Absolutely not.
They fight, we fight.
Yes.
What are we planning for the future?
Oh, a lot. Because there's a lot to do, we have a lot of plans. We not only want to train, but we want to change curricula. We want to make sure that younger generations and those even older continue their development process and get enough knowledge on providing gender-affirming care. It should be something that should not just fall on the shoulders of NGOs, but it should be something that academic institutions take on. It is part of their mandate. It is their responsibility.
I believe حتى education, it starts with education. It starts من لما نحن صغار عم نكبر.
Yes. بعدنا we haven't even started tackling education in schools. We're still targeting universities and organizations, but it needs to start in schools because imagine getting to university without knowing any of this or having any basic ideas. So we need to start working on that, but we need to also start collaborating with organizations and even the Na'abet and the syndicates that can make these changes on a much more permanent basis, on a much more sustainable basis, because an NGO might exist today, it might not tomorrow, but the work has to continue. The change has to continue, so it has to be sustainable. In addition to that, we have to work on making sure that the policies that are being set in place are being implemented. It's not just about having the words and making it look pretty for accreditation purposes or for showing that you have this policy, but are you really implementing it? What are your accountability pathways? How are you making sure that your staff are implementing this? I think this Kamena has to go with with collaborating with administrations to make sure that their companies and organizations are following their own policies. We have a lot more work to do in not only advocating for this, but also even maybe in the provision of some of the services that are not yet ready for the community in the organizations that are supposed to provide them.
في عندي كتير organizations على فكرة for budgeting reasons أو for popularity بيقولوا لك نحن we are advocates of the LGBT community, we are for loved ones بس إنه in reality.
But then we need to change some of the inclusive processes or in this case now exclusion practices. For example, documentation in hospitals, right? Or the files that we fill in. They're still based on the binary, a male or a female. So a trans individual has no way of expressing or presenting as they are legally or at least organizationally. At the same time, we don't have preferred pronouns on forms. We still rely on the legal IDs, etc., etc. So if these organizations really want to be inclusive, then they need to start looking at their documentation processes. So there's a lot to do. It never stops, and we're happy to be in a position where we can be change makers, at least working for the community, with the community, collaborating with others, doing the work with us. So yeah.
I know on a personal level what you do where you work at, and it's an amazing thing. وسام لأننا that you are able to reach this level of بركي policy change, بركي education, بركي curriculum, anything small would make a huge difference.
Yes.
Why is our mission so important? نحن حكينا about the importance of those policies, the importance of life now. But I think بركي كمان for the future.
Yes.
For the future generation, how important is it for them?
One of the things that makes what LebMASH does very important is that health is a basic right. Access to healthcare is a basic right. The minute these avenues or these institutions and organizations become inaccessible, then it affects directly the quality of life of the individual. So we cannot stop. You know, like if somebody needs healthcare, they're not going there for the fun of it. They're not going there to have fun within the organization. They're going there because they need vital, crucial services. And they are in a position, organizations and providers are in a position of power in that case, because they're the only ones who can provide this service. And if they're not ready for these patients or clients to come to them, then we have a group of people who are already marginalized, who keep being placed and excluded at the margins of society. They cannot live a full life if they're unhealthy. They cannot live a full life if they're sick. They cannot live a full life if their identity expression is being stopped because the provider doesn't think that hormonal therapy is good or is something that is credible or something valid. So the minute that the healthcare industry starts invalidating these experiences, it keeps putting these individuals on the margins. And LebMASH is at the forefront of making that change, of creating avenues for change, of generating knowledge that will lead to change. So we cannot stop. This is why LebMASH specifically and its mandate is so important.
Anything else you'd like to add?
I think we talked a lot.
We talked a lot.
I think we covered everything.
على فكرة بس to put it on the record, you عن جد inspire me with what you do لأنه I have mad respect towards you. عن جد مش لأنه كاميرا ولا شيء بس عن جد I do have mad respect towards you لأنه what you do is what I hope someday I will do in my future, and this is what I'm trying to do هلا بحياتي currently. Thank you very much عن جد. Thank you so much for coming to this episode for us. هيدي آخر حلقة هيدا season. هيدي السنة. Happy holidays. I really hope you had a good, fruitful and nice year, and إن شاء الله كمان سنة الجاية بتكون أحسن وأحسن للبنان ولنا on a personal level and for LebMASH as well. Thank you so much.
Thank you, and thank you for the kind words. I highly appreciate them. They make everything worthwhile. And thank you for the podcast, for bringing your idea to fruition. It was a brilliant idea. The work that you've done has been great. I hope the coming year would be even better for everybody in the community and for us. I hope we can do more. I hope that we'll be more visible. The community will be more visible, and will be able to reclaim the spaces that are our due and our right.
Thank you so much, and happy holidays.
Thank you. Happy holidays.